This conference will now be recorded.
Hello, people. How are you? Hope you are doing well and preparing good for your MRCUG Part 1 exam for the January 2024. And I wish you good luck, and I wish that all of you pass with bright colors, and we meet you in MRCUG Part 2 preparation as well. And today I'm here to just with the some tips and tricks which will help you in cracking the exam in one go. Maybe this video will not be as beneficial for the fresher candidates as for those who are already preparing. So I would just give you some glimpse of how to start preparation of the Part 1 exam. So, as this is your entrance in the MRCUG journey, and passing MRCUG and becoming the prestigious member of Royal College is the main aim for whoever enters in the MRCUG exam journey. So this is a great achievement, and now in India, it is a well-recognized degree by MCI as well. And MRCUG makes you qualified to work as an obstetrician or gynecologist in England as well. It is also one of the most valued certificate in the obs and gyne specialty, and has acceptance in many countries of the world. So, MRCUG, as you will be teaching all the evidence-based guidelines and the aspects of ethics and the skills and the communication skills with the patient, with the families, applied clinical knowledge, a detailed applied clinical knowledge, what to do, what not to do in difficult scenarios. So, and a thorough study of the Green Top guidelines, talk articles. This all you are going to have in your journey, and this will make you a very good clinician as well. And this will give you, immense happiness and satisfaction while practicing uh, in your own clinic as well. So if you don't decide to go to UK or outside your country and want to practice in European countries, then also it is a very, very valuable degree. It just finishes you up to the finest. Um, why MRCOG? If I continue that, so it's a top tier qualification, great, and it comprises of three parts. So this part one you're going to give, it is basically the knowledge of the obs and gynae. um, Basic sciences means the anatomy part, whatever is relevant in obs and gynae, that you will be studying. Biochemistry, as far as it is related to obs and gynae, you will study that. All the topics of the basic sciences, what we have read in the MBBS exams, those will be there, but not all. It will only be related to the obstetrics and gynae field. So that's a relief. And it will be now there is a clinical management part also in part one. So that also is a good scoring part. And uh, whoever have cleared the masters of obstetrics and gynae, they will be very much benefited, and they will find it easy to clear. Then comes the part 2 exam. They both are written exams. They evaluate your part 2 evaluates your clinical knowledge and problem solving skills in obstetrics and gynae. So in part 3, it is an OSCE, like objective structured clinical examination. It's kind of a viva, but it assesses your communication skills, clinical skills, decision making in various scenarios of obs and gynae. So when you successfully complete these three parts, that leads to the certification for the MRCOG classification qualification, and it holds the global recognition, as we all know. So what will be the format for the part 1 exam? Focusing on that, there will be that will be computer based test, and we all know that. Um, the particulars are like, it will be 2.5 hours for each paper. There will be two papers, one and two, and there will be SBAs. So 100 SBAs will be in paper one and 100 will be in the paper two. in between there will be a lunch break of 1 hour, and you can take light refreshments in that. And uh, you know um, you can study by yourself or you can have a study partner. That's entirely your choice, your comfort. If you find that your schedule is not matching with any study buddy, then you can definitely prepare alone also for this MRCOG part 1. There are very good telegram groups, and who can guide you and who tells you like what questions or what books you should solve. Now, once you have booked the exam, how to start your journey? So this is a most important picture you should all have on your wall when you book this exam, because you should know that you can write down the percentage also in front of that, or uh, because you see the anatomy is carrying a lot of part of this circle. So anatomy is very very important, means you should give more time to that. And then biochemistry is not as important as anatomy, same as for embryology. You only need to understand the embryology which is related to obs and gynae, just related to obs and gynae, and that too. When you will be doing the question and answer, then you'll be going retrograde, and the more question answer you'll solve, the more you will know that only these many parts are being covered from the embryology portion. Then endocrinology, yes, it is very important. Statistics are very important. Then genetics are also like very small portion comes, very few question answers. And as soon as you will realize that you you're doing the recalls and you're doing the question answers, then you'll realize that genetics part is only limited to few question and answer or few things which are being asked. Yeah, and then physiology. Physiology is important always. And same here in this circle, you can see that most of the part is being covered by pathology and data interpretation, which is very important and very easy as well. It is highly recommended to revise data interpretation just before exam, just before 2 or 3 days of the exam, to because you may find exact questions and you need to know the formulas so that you can solve them. That is, maybe there can be some changes in the numbers. There may be some changes in the numbers, but as such questions are coming straight away and repeats, mostly they are repeatedly coming. So the data interpretation is very important. Then immuno and this immunology is playing a very less part. Then coming the pharma is really very important. It will help you in in your studies throughout your journey of MRCOG, because you need to understand what is the role of every drug in the clinical scenario as well, and the doses and the side effects. So pharma you should do by your heart in MRCOG part 1. Then clinical management is also being added, so that is also playing a good role in this. So they all are the basic exams which and basic sciences subjects, and you need to understand the importance of each and every subject and weightage you need to give for them for your exam smart exam preparation. So whether you want to take the first column, if you want to take the first column, then first of all you need to understand that you cannot start studying in details for from all the books available for the MRCUG part 1. You should have revision notes and all the recalls and flashcards which are available, freely available in the Telegram groups. So that study material you should collect. Revision notes is a beautiful book, and that should be your basic reference book. If you want to go in detail about any other subject, then there are other books also which I'm giving reference of, that you can see or you can go through about that particular topic. Keep a notebook ready, read the variety, do not get stuck in, if you I'm asking you to use the revision notes as a basic that book. That does not mean that only the amount of information given in revision notes is required. Okay, you need to know all the related compartments also of the particular topic. So retrograde method is the best method to study for part one. If suppose you have booked just before a month of your exams or 2 months before your exams, then just take out your revision or take the revision notebooks and recalls, all the recalls you can collect, and you can start from the recalls and go retrograde. Like if you are doing one recall, whatever question is coming, you should do the theory part from the revision notes. And if you find that this theory is not clear from the revision notes, then you can go in detail from the another textbook. So like that you are covering your that topic which is significant from the point of exam view. So you are not wasting your time in reading the whole topic of, suppose if it is genetics, you are not, reading all the structures of chromosome, chromatid, then the, every step of meiosis, every step of mitosis, and you are not bothered about the how this, what are the examples of autosomal dominant, recessive, X-linked, dominant, recessive, and then the question comes about the inheritance. And if we don't know that this disease comes under what inheritance, we will not be able to solve that question. So that's why even if you have completed the whole of the genetic, but that is not coming in exam, uh, though it will totally not go in waste if you study any topic in detail, but doing the recalls are must, and studying with the help of recalls pay you the most, because you have to pass this exam also. So if you want to do the smart studies, you should do the recalls and do the topic in details. Okay, so and more recalls you'll do of past years, past 10 years suppose, so you will be covering maximum like 80% of your you can say syllabus in details, which will help you in exams also. So join the telegram groups for question banks, keep on solving the questions as much as possible, as many as possible. We are also putting brainstormers in our group every day, but I see that none of you is enthusiastic enough to solve the questions. So I would request you all to participate in question answer sessions actively, because this is the, these are the things which open up your area of thinking and widen your area of thinking. So make it a routine to solve as many questions as possible. Now, regarding the materials, the revision notes for part one, this should be your basic book. Then the question answer from the revision notes are also available, sample SBS. They are also very good. You should solve this book. And then SBS for the part one MRCOG. So this is the book by Andrew Sizer. So you should solve this book as well. And for the detailed theory, you can go for this RCOG's MRCOG Part 1 second edition book. So this book you can take as a reference. Then all the 10 years, past 10-year recalls at least. This I have already covered. Know your syllabus well and the pattern of paper as we have discussed. So I've given you examples of genetics also, like read the notes, solve the papers. Now read notes again and mark the recall questions. So by that way, you know how to highlight a point, how to solve the question of the recall as well, and how to study and do practice, practice, and practice, which will make you perfect. And your top 10 steps for study skills. You should find the best method of study for yourself. If I tell you something that is from my experience, that I have cleared all three exams in one go by my own way of studying, then but what suits you the best, you should do that, because that will only give you confidence, and you a pass for you. Eat well, exercise regularly. Doing exercise is very important. Don't live a sedentary life because of this exam. It is a long journey. You should keep yourself active. Your endorphins should also be released regularly, so that you will be able to manage your family life and your this MRCOG journey life, also your professional as a clinician life. So stay positive, get enough sleep, take frequent breaks, set your goals, try to set your goals, and find the best study time for you. Like for me, it was always 10 to 1 in the night when my kids used to sleep by 9:30 or quarter to 10. And after that, I used to study till 1 o'clock in the midnight. So you can find your best time, whatever is for you. Exams can be good. Sleep on time. So we are launching a 6 weeks fast track course for January 24 candidates. So I would like to know in the comment box whether you are interested in joining it or not, because I would be posting it in Telegram group also. So you see, this is the uh, fast track 6 weeks course, which is starting from today. This session is also included in that. Next session will be on the anatomy, embryo, and genetics. I will be covering all the recall questions. Yes, in these classes, recall questions which are related to anatomy, human anatomy, embryology, and genetics. Only recalls and recalls related theory, which is my way of studying. So I will be sharing with you that on the 9th December, and same in the 16th, like at every Saturday from now, from this week, every Saturday, we will be doing these many topics, these many recalls and related theory. It will end on 6th January, and then we can plan a mock test for all of you who have joined the course regularly. I will be arranging a mock also for you. So I advise you and wish that you all will join and get the maximum benefit from this course. And I would like to say that please do join the group as well. We are on Facebook, Instagram, and as do Victory Academy, and Telegram also. We are the open group, so anyone can join us. So I wish you all the best for 24 January candidates. Go forth and shine bright in all whatever you do. Good luck, and your fun of studies begins now. You have to study a lot, a lot, a lot for next 1 month, and you have to just give it a pass and enter the journey of MRCOG Part 2, which you would love the most, because it's full of clinical knowledge and you would definitely love that. So just across this Part 1 exams, there's again a very bright future for you. So all the very best, and if there are any queries, you can ask me in the Telegram group. You can give the personal message as well. You all are welcome. So by saying this, I would like to end this session, and we will meet again on next Saturday. Till then, bye bye, take care, and study very, very hard.